Hello, everyone. Good morning, good afternoon, or good evening, as the case may be. Welcome to the 16th Asia Impact webinar on COVID-19 and well-being of older persons in Asia. I'm Yasu Sawada, Chief Economist and Director General of Economic Research and Regional Cooperation Department of Asian Development Bank (ADB). I'm today's co-host together with Dr. Tom Park. As we all know, coronavirus disease has had a disproportionate impact on older persons. As of 1st December, COVID-19 has claimed lives of some 180,000 people in Asia and Pacific alone. A large proportion of these deaths, ranging from 40% to 80% across the countries, are older persons aged 16 and above. Across the country in the region, older persons are observing social distancing to avoid infection. The benefits of these preventive measures are obvious, but they come with some indirect consequences. Some are having difficulties meeting basic needs such as food and health services. Many seniors cannot afford the visit of families and friends, which put them under great stress as the period of social distancing extend are expected to lead to many of us for such a long time period. How to protect older person from pandemic while promoting health and active aging emerges as a major policy agenda for the region undergoing rapid population aging. It is at most important to be vigilant on how the seniors in our regions are faring in these difficult times in terms of their economic security and their physical as well as mental health. In developing Asia, one important challenge in containing pandemic and keeping older persons safe is the issue of multi-generational co-residency setting, which is the predominant living arrangement among older persons in many Asian countries. The burden on informal caregivers, especially among women, in the period of strict movement restriction can extremely large. What are some of the good practices the Asian government could adopt to ensure all persons' access to essentials, social connectedness, and support their physical and mental health? These are some of the questions we hope to discuss and get insight from the webinar today. Today, we are very lucky to have 4 distinguished experts on population aging from the region with rich experience in guiding policymakers to help us answer these questions. I look forward to insightful discussions and innovative ideas on how to address the needs of the older citizens in the region. With that, I'd like to stop my opening remarks. Now, let's move on to the first segment of today's webinar. It's a presentation by Dr. Dong-Kyun Park, Tom Park, Principal Economist of Economic Research and Regional Cooperation Department of ADB, making a presentation titled Wellbeing of Older Persons in Asia, a brief overview. With that, Tom, floor is yours.
Thank you very much, Yasu. Okay, let me make a short presentation on the impact of the coronavirus containment measures on the health of older persons in Asia. And I will also briefly introduce a research project that we at ADB are starting, me, myself, Aiko, Grace, Beth, and Cindy. Next slide, please. As the chief economist just noted, the older people are particularly vulnerable to COVID-19. Most of the COVID-19 death are accounted for by older persons because they tend to have weaker immune system and they also tend to have pre-existing conditions. Next slide, please. Rightfully, governments in Asia and around the world are implementing lockdowns and social distancing restrictions and stay-at-home orders. Of course, these are absolutely necessary to contain the pandemic, but at the same time, it's having a negative impact on the physical health of older persons because they can exercise less, they can do, their ability to undertake physical activity is diminished, And also they often postpone regular hospital and medical checkup, which also is harmful for their physical health. Next slide, please. And social isolation, or being cut off from friends and family, that's having a negative impact on the mental health, not just physical health, but mental health of older people. So evidence from China, the PRC, and Japan indicates increased prevalence of depression, dementia, and other mental disorders. And on top of that, the survey coordinated by the World Health Organization, or WHO, indicates that around 70% of mental health services for older adults were interrupted or disrupted during the pandemic. Next slide, please. And to make matters even worse, many older persons in Asia work to achieve economic security, but because COVID-19 results in lockdowns and other social distancing restrictions that restrict the ability of people to work, including the ability of the elderly to work, that threatens their economic security. Next slide, please. And one particular aspect of the elderly in Asia is that many of them live with their children and grandchildren. In other words, many households in Asia are intergenerational, and this intergenerational living arrangement has many benefits, but it also has imposes a great deal of burden on family members, especially women, who often take care of their elderly parents and elderly parents-in-law. Next slide, please. And to make matters worse, the elderly often suffer from lack of familiarity with ICT or digital technology. The elderly, the age group that is least familiar with ICT. And of course, this pandemic showed how important, how vital ICT is as a tool for living, for working, and so forth. Next slide, please. So some key questions that will be discussed by the panel that my colleague Aiko will lead is economic security of the elderly, mental health of the elderly, especially the impact of COVID-19 on their mental health. This multi-generational living arrangement, how that affects various family members, including women who take care of their grandparents and parents-in-law. And last but not least, what are some key policy recommendations? What should Asian governments do to improve the well-being and productivity, the health and productivity and well-being of the elderly? Next slide, please. As I mentioned earlier, Aiko and myself and Grace and Beth and Cindy, we are starting a new research project to look at this issue of improving data and analysis for healthy and productive aging. So this research project has three components. One is to collect data to better monitor the state of older persons in some Asian countries. Second, we will be doing innovative research on a number of issues, such as universal health care for the elderly, or universal health care in an aging society, such as cognitive ability, mental ability of older persons, such as financial inclusion of older persons, and last but not least, the role of technology in improving the quality of life of older persons. And we will also do a big comparative studies among DMCs based on micro survey data. And with that, let me pass over to my colleague, Aiko, who will lead a panel discussion with 4 distinguished panelists. Over to you, Aiko.
Thank you, Tom. And greeting to distinguished panelists and webinar participant. My name is Aiko Kikawa Takenaka, and I lead the upcoming ADB's regional research project on population aging with Tom. And this panel discussion aimed to bring more clarity on the impact of COVID on older person and identify the policy priority and actions. So Tom's introduction presentation really shows some of the indication of the impact of COVID on physical health, mental health, and the economic security of older persons in Asia, which consists in two layers. First is the direct threat of COVID and the higher possibility of complication among older persons. It's also important to stress that there is evidence of secondary effect, which is caused by prolonged period of social distancing that limits their mobility and social interaction. So we really hope to learn from the panelists here in more detail about the status. And we also would like to hear their view about the priority needs of older person and whether and how these needs can be addressed by country system in the context of pandemic. The session is joined by 4 panelists who are region's leading scholar and practitioner on the topic. We have first Professor Sanyop Lee, the Senior Fellow at the East-West Center and Professor of Economics at the University of Hawaii. Professor Noma Mansour, Director of Social Security Research Center and Professor at the University of Malaya. Also joined this panel, Professor Naohiro Ogawa, Visiting Fellow at the Asian Development Research Institute. He was also Professor of Population Economics at the Nihon University. Our 4th distinguished panelist, Dr. Marianne Tsao, Chairperson and Founding Director of the Tsao Foundation, which is a non-profit foundation dedicated to aged care, aging issues, based in Singapore with its work extending to other Asian countries. So welcome panelists to the session and thank you for being with us today. Let me start the first question by asking to everyone. From your perspective of the field, and the field of practice, how do you assess the current state of older person in the region? Or put it differently, in what way have their situation changed in the past 11 months? Let me start by Professor Lee.
So next slide, please. Okay, so I mean, Donghyun actually, the presentation includes all important topics. So let me just fill some gaps, I think the health outcome is the most notable effect on older people. That's the most important. So you already have seen this kind of percentage, in India, for example, elderly 60 and older deaths accounts for about 50%. In People's Republic of China, it's 81%. In Korea, if you look at these pie charts, the COVID-19 related deaths is is concentrated in older people 60 and over, and then 60 and over's deaths accounts for 95% actually in Korea. So there is no actually death under age 30. But so there are some actually interesting issues. Assigning a cause of death is never straightforward, and whether the people died of versus died with coronavirus is also very difficult question. And the limitation of autopsy facility, and some people actually don't trust some countries actually statistics. So because of lack of transparencies, and obviously the old age structure are very different across countries. That's why in Korea it's 95 versus in India it's 51%. Next slide, please. So suppose you don't have this kind of very detailed cause of death data. Then, but still, countries that have all-cause mortality. So I would call it actually excess. So you can actually estimate kind of excess all-cause mortality during the pandemic by age. This data shows the South Korea beginning January 1. So this is weekly data. So the shaded area is a range of weekly deaths between 2017 and 2019. So you see this shaded area, the highest is max and the lowest is minimum. So if you look at this, and the solid line is 2020. So the difference is between this shaded area and the solid line is excess mortality in 2020. So if we look at this mortality by age, there is not much difference on age 65 and 84. They belong to this shaded area. 15 and ages between 15 and 64, they also belong to this maximum and minimum, which is a historical data. But if you look at the 85 and older, beginning February, the number of deaths exceeds all the time, every week, exceeds the number of deaths in the last 3 years. So this actually has some advantage because when you don't have a very good data, especially cause of death, so you can show the all-cause mortality. And this is a number one most important factor. It affects the health outcome of the oldest older. Next slide. And also Dong-Hyun talked about this, social isolation, and the family is the most important actually provider of social care. But in some countries, social welfare centers or senior centers are major source of social gathering. Again, this is a data for social Korea. So after the pandemic, most of them closed. So shutting down of these senior centers or senior welfare centers where the elderly meet and change information and also get information about like dementia, it actually increases the depression. We call it Corona Blue test, right? Corona Blue. This depression test shows that highest score for 60s for men and 70s for women. So in addition to the family, care and this social isolation due to shutdown of this social welfare centers is huge. Next slide. Okay, this is actually interesting graph. This is also, I'd like actually add some, fill the gap or provide some interesting data. This shows the net value of time transfer at home. That means it's a care receiving time minus the care giving. That means if the number is positive, the person is receiving time from their family members. If the number is negative, then they are more giving than receiving time. So this shows by age and gender in Korea. So for men, they are always receivers. They always receive time from someone from their family members. But for women, beginning age 23, they always give until age what? Until mid 80s. So even older women are actually providing care for either for their grandchildren or for men, older men. So there is a gender imbalance. This is actually one of the impact of the COVID-19. The next slide. Okay, we can actually see this kind of a gender specialization. This is Vietnam data by subtracting male time spent from female time spent. So this is a female time spent minus male time spent. If you look at it, so if it's positive, the female provide more time on this. If it's negative, the male receive more time. So that means if we look at unpaid household care and services by age, women provide much more household care and services, and women also receive much leisure time, enjoy much less leisure time and self-care. So this shows the gender imbalance. Next slide. Actually, I will stop here. I have a lot of actually things to talk about, but this is actually next question, right? We'll talk about the working and all that. So I stop here. Thank you.
Thank you very much, Dr. Lee, for your presentation, initial assessment. We would have a Q&A session later on. So now I would like to turn to Professor Mansoor to discuss on the case in Malaysia. Dr. Mansoor.
Thank you very much, Aiko. A very good afternoon and good morning and evening, everyone. I would like to share the results of two surveys in Malaysia that would describe the situation, how it impacts the older persons in the country. Yeah, these two studies are next, please. One is a study by the UNDP. Yeah, we are doing some work. The center is doing some work with the UNDP, and UNDP had conducted a survey, an online survey and phone interview from April to May. So this will be after about 2 months of the pandemic and the lockdown in Malaysia started around mid-March. Yeah, and we have, although it was supposed to cover the vulnerable groups in Malaysia, but we were able to collect or to get for the elderly, which is 60 and older, about 33% out of the 6,465. Yeah. And the other survey is the Malaysia Aging Retirement Survey that we do ourselves. And this survey was conducted before the pandemic. it was last year until end of last year, and we collected on various aspects of aging among all Malaysians, across the country, age 40 and older, and we have also look at the 60 and older, which is about 40% of our respondents. Yeah, so the total survey for Mars is 5,613. Next, please. And the findings of these two surveys are very interesting, especially on Rahis. They are looking at various impact, the socioeconomic impact, as well as the mental health. And the graph here shows that among the household with older persons, the impact on the income. Yeah, and as you can see here, that the categories are no impact, reduced up to 20%, reduced between 21 to 50%, and reduced by more than 50%. As you can see that 37% of the respondents age 60 and older mentioned that they recorded a 50% reduction in their household income. And when a question was asked on whether they have enough supply of food and other necessities for next week's use, 70% or 71% responded that they have enough, and 30% noted that they would have no food for next week. So this shows how unprepared, yeah, the Malaysian households are for this kind of pandemic. Next, please. And from Rahis still, on access to healthcare, 42% of older persons found it harder for them to access healthcare. Yeah, and although this covers the other vulnerable groups as well, but you can see that about 49% here says there's no difference, whereas 42% says that it's harder for them to get access to healthcare. And the next category of questions is about the mental health, which can be reflected by these behaviors: an increase in tobacco or the consumption of alcohol, physically aggressive behaviors, rising tensions, depression, and also psychological distress. And as you can see here that there are about 25% shows the negative behaviors among the older persons. Now, so it didn't, the impact isn't that great, maybe because of what Sawada-san mentioned earlier about the multi-generational household that majority of Malaysians from our survey shows that majority of Malaysians are with multi-generational household. Next, please. From the Malaysia Aging Retirement Survey that we looked at 60 respondents age 60 and older, in terms of the living arrangement, about 80% of them live with other family members. The blue, this is reflected by the blue part of the pie, yeah, and 15% living with spouse only, and a small percentage says that they are living alone. So the family relationship among Malaysians is still very strong, and there is a level of comfort there, which is reflected earlier on by the Rahis survey. And it shows here that when a question was asked whether they get family support, majority says yes for the, and given, so for this question, we asked both whether they give support or whether they receive support, although we did not have the sex disaggregated as Sangyup did for other countries earlier. In our case, it's both male and female. And as you can see here, they also give support to family. Yeah. Next, please. And on the healthcare, the health questions that we asked our respondents was whether they receive outpatient medical treatment, and majority of them receive from the government health facility or practitioner. Yeah, a large majority is about 79%, and a smaller percentage will go to private healthcare. And also Malaysia has the universal healthcare, and also an increase. So this shows that healthcare facilities, aside from giving the outpatient medical treatment, would also have the impose or increased burden with the COVID-19 epidemic. Yeah. Next, please. Thank you. I think that's all. Yeah, and I end my presentation. Thank you.
Thank you, Dr. Manso. And the figures which seem to be different and having the implication on the multi-generation family was very interesting. It shows the power of the survey data you have that can present this kind of information. Now, let me turn to Dr. Tao on the case in Singapore and also in the region where her foundation covers. Dr. Tao.
Thank you very much, Akiko. So from Singapore's point of view, I think that what we observed is very similar to what was presented by the other presenters so far. I think Singapore actually done relatively well because they've been very strict about public health measures, but also means that during the lockdown period is that the number of people, older people allowed to get services, get a house is actually very strict as well, because everything the public health law around COVID was very strictly enforced. One of the key things that's actually a very strong message that's been put out to the public as well as older people in the family is older people, all older people are very vulnerable. And I think the message was very successful in the sense that most people have stayed home, but even past the lockdown period, that message has lingered, and that long-lasting effect of older people think they're vulnerable and not want to go out even when things improved, and the fact of family members also telling them that's dangerous when they go out. I think this effect about the lockdown and the long period of social isolation, distancing, is living beyond the current situation of well-being. So that's something that would be very careful about how we send the messages, because obviously these things linger. And one thing, of course, is that the strong message for older people, all older people being vulnerable, it may have some negative ageist impact on the younger population overall that may have a long-lasting effect as well. The second point I want to make is actually, of course, is that older people are not all the same. It's a very heterogeneous group. And depending on the situation, the response is very different. A lot of times depends on how the pre-COVID period of health, the function level, their social connectivity, the living arrangement, the caregiving arrangement, and of course, very importantly for Singapore was actually the digital divide. You might have seen from one of the previous slides from the other panelists is that the digital literacy of older people in Singapore is actually quite low compared to Korea and other countries. And that has shown up, the digital divide has really shown as one of the biggest issues. I think there have been studies from different universities, from Singapore Management University, that show that about 60% older people are digitally online and 40% not. Actually, that's an overestimate because they really surveyed only people between 55 and 75. And so of course, the younger or older are more likely to be digitally savvy. Amongst the older people, they're almost none. Based on our own survey, which is about 200 people of the community, older people, once they get past 75, only 30, not even 30%, but 20% of them are able to get them any kind of online. And mostly it's not on them, it's really the family members able to help them. And so therefore, if you look at the different people, I think one of the key things is that I think service and policy obviously target single elderly. If we look at the mental health aspect, generally speaking, has been the biggest impact. Overall, the Singapore Management University served about 5,000 plus older people between 55 and 75 till about July. From May, I think March to July, and the paper was published in August. That fact found that overall, the anxiety depression level is very high. Most of the older people felt that there's a high level of anxiety around uncertainty of the future. About 40% of older people felt they're worried about them getting sick. And around also saying about 40% felt that they're worried about whether they might get the healthcare they may require. And generally speaking, there's concern about loss of income, not so much by themselves, because a number of older people working for incomes relatively lesser, but they're very much concerned about the children on whom they're dependent on for economic support, that the children may lose a job. So the general sense of anxiety, depression around that's very high about uncertainty of the future. Things might have gone a little better now since August, because since then, the situation is under control and we're slowly opening up. But so we look at it now, I think when these studies are done also reflects really how older people think about their well-being. Again, like I said, the older people is a very heterogeneous group. The group that was hit the strongest based on our observations for the SMU study is a single elderly. Most of the single elderly are actually also the lower socioeconomic group. And those are groups that can imagine if they're locked down for long periods of time and they have no access to any digital information other than maybe a radio and a TV, they cannot connect with people other than by telephone, is that they're the hardest hit in every regard. As a matter of fact, in the early days that people routinely broke the rules about not going out, our older people were single because they just trapped at home. They feel so lonely, so depressed. They just have to go out. They just say, I don't care. I might as well die like this because I just got to get out. They're not looking at four walls every day for certain periods of time. The other groups that's also the hardest is those who are older caregiver caring for older spouse, older person, particularly those with dementia. Quite a number of our older people with dementia actually care for an elderly spouse, oftentimes it's a wife. So for those who are usually getting some service or family members coming or being able to go to day centers where the older person, the caregiver can give some respite, that group has the highest distress, both psychologically, emotionally, as well as physically, because they're not allowed to have any care, any family member visiting or any of the volunteers that normally visit. So I think the psychologically, what we found is interesting is that the group or the well elderly who are usually very active and very socially out with lots of friends, they also had the hardest time mentally because they're so used to being out and around that when you lock them down, whether they're with family or not, they have a hard time. Like a rest of part of Asia, most of the Singaporean older people do live with the family, about 75% of them live with the family. And the good news is that 53% have reported that their family situation got better. The children are home, the grandchildren have more time with them because they're studying from home. The family bonding relationship was better. About 10% of them reported a worsening of well-being because of more tension at home. Family members not usually cooped up at home, are all home, all trying to work together, work from home, online and all that. And many of the caregivers are not, family members are not used to caring for an older person. Usually older persons are day center or something like that, particularly the frail ones. And when they're home together, they don't know what to do, particularly people with dementia. They really, the change of the routine, the older person not being day center, they're not out 5-6 days a week. When they're home, they really don't know how to handle them. And that's one of the biggest issues, that preparedness of the caregivers are not consistent. Quite a number of them are not actually prepared to caregive during a long period of lockdown with not getting support, the usual support they would have. So I think generally speaking, so the mental and physical health is both affected. Mental health, I find that the relatively well older persons are now getting better. But now more of them are getting back out, moving towards their normal activities, even though many of them are still told by their parents or family not to go out because it's dangerous for them out there. But it is improving. The physical health, I find that generally speaking, the well older person also has a deterioration of function. There was one older gentleman who's 73 who used to be able to play 18-hole golf and walk the whole way and carry his own clubs, was barely able to walk not even half of them and cannot really play the golf anymore. And he was a very physically active person. The good thing is that those are slowly getting better. The well older person who lost function are getting better. But those frail ones lose function, medically deteriorate, cognitively decline. The death rate, as was shown by one of the other presenters, definitely went up. The rate of hospitalizations went up, and many more of them are not reversible. The ones who lost function became worse were not reversible. So all in all, I would say that there's some positive impact in the sense that the ones who live in a family reported better emotional outcome with the family, but overall, I think the mental health and physical health impacts are as high, particularly for the single elderly, particularly for the low income, and particularly those who are already frail. I will conclude here. Thank you.
Thank you very much, Dr. Zhao. Now we turn to Dr. Ogawa. Perhaps I can elaborate more from his observation from Japan. Dr. Ogawa?
Yeah, thank you. Well, I think I'm talking about demographic change and the value shift and also dementia in connection with COVID-19. Well, in the year 2005, Japan became the oldest nation in the world. Prior to that, 1950s, fertility went down very fast, like 10 years time, fertility went down by 50%, which is the first time in the history of mankind. In 1964, Japan joined the OECD. At that time, Japan's life expectancy was one of the lowest ones among all the member countries, but only 10 years later, Japanese life expectancy became the best among all the OECD countries. So changes are very, very fast. coupled with the rapid demographic changes, the norms and values related to the filial piety have changed quite a bit in the second half of the 20th centuries. Let me give you some examples here, evidence, maybe here. This one. Okay. The graph here came from the data gathered by my newspaper back in the newspapers. I mean, they started collecting data from 1950 in the survey called the National Family Planning Program. And then the question is, the beauty of this survey is that they conduct a survey every other year, and they use the same sample framework, and also the questionnaire is highly comparable. And according to the survey, back in 1960s, early 60s, the respondents and women of reproductive age below 50, the mothers of reproductive age below age 50, here, the early 1960s, almost 80% of the Japanese mothers said it's a good custom or natural duty to take care of the elderly parents. The question was, what do you think about taking care of parents, older parents? So 80% of them are very positive about supporting their parents. So, but somehow, oh yeah, finally moved. Somehow, after 1986, it dropped like crazy. So what happened? Well, in 1986, government of Japan introduced the in-home care. The reason is that, all up to that point, the Japanese medical expenditure was going up very fast because of the longer duration hospitalization period. So governments decided to send the elderly inpatient back home. And so the Japanese women were very negative about the filial piety. The values related to filial piety. At the same time, proportion 65 and over, living with children kept on falling like that. And in the 21st century, it went down further. And it's really shocking. Right now, only 20% of the Japanese mothers of reproductive age below age 50 are supportive of their elderly parents. And here, year 2000, Japanese government introduced long-term care insurance. But by implementing administering the scheme, government realized that the number of dementia cases have been increasing very fast, particularly after the turn of the century. So they actually did the projection. Right now, in 2020, more than 6 million elderly persons aged 65 and over demented, which is 17% of the elderly population. And it's going to be more than 8.5 million, and 25% of the elderly person will be demented, which is very scary. Actually, the government in Japan trying to, of course, support these people. These demented elderly persons are living alone in many cases. Like 25% of cases, 20% of cases, they're living alone. And so the government decided to change this emphasis from the family support or family care to community-based care. So in order to facilitate that shift, they actually advertised this volunteer service, voluntary program called Dementia Supporters. In fact, we have about 13 million people joining this voluntary program, and these volunteers visit these demented elderly persons living alone and so on and so forth. And then they take them to the place like this, Dementia Care Cafe. And then by going to these places, they talk to each other's problems. They communicate, they're trying to develop a network system. And that way they're trying to avoid the depression problem and so on and so forth. And then, and the government of Japan, and actually the last year, June last year, the former Prime Minister Abe implemented the framework for the promoting the dementia care. And the idea is that trying to reduce the onset age of dementia by 1 year during the next 10 years. And then last year, October, and Japan was actually G20 presidency country. So they hosted the international conference in Okayama City, actually ministers conference, health ministers conferences. And then actually dementia was given high priority in the Okayama Declaration as one of the extremely serious and serious health and social care crisis of the 21st century. But due to this COVID-19, nothing much has been done up to now. Thank you.
Thank you, Professor Ogawa. And the statistics on how people feel about the need for their willingness to care for their parents, or that the statistics about dementia does give a very powerful story, and that's something that the developing listener from the developing Asia would have to chew on as their country also ages. So now let us turn discussion into some of the respective component that we would like to discuss. One was on economic security. So more than a third of the individual aged 16 and above in developing Asia are actually working. And how this COVID has affected the risks and their ability to earn income. Are the government transfer meeting their needs? And what could be then the 2 to 3 policy recommendation that you would give to address the economic security? We would like to pose this question to Dr. Lee.
Okay, I'm not going to use any PowerPoint because we don't have much time. So, older people are less likely to work. We already to telework, right, after the pandemic. We already know that. But actually, I just completed some papers that using a very large longitudinal data in the US and Korea. And the results suggest that the elderly who cannot use or cannot access to internet experience a deterioration in self-reported health and also develop depression symptom over time. So this suggests that internet use is very important for both the working and health for older people. And also you asked how people are doing, in terms of government transfers. If you look at so-called income quintile share ratio, that means the top share of top people versus the share of bottom people, it has increased substantially after the pandemic. So income inequality has increased. However, if we look at just the disposable income, it doesn't increase much. So that means there is a role of government. Government actually give a lot of transfers, so role of transfers. So that's why the so-called disposable income has not changed much. So you can actually compare across countries and see how the total income versus the disposable income changed. That's very powerful, actually, graph. The third point is that elderly developing economies are much more affected than those in developed countries in Asia for 3 reasons. One is elderly developing economies rely much more on labor income to support their consumption compared with the developed countries. And elderly are also more likely to be self-employed than the percentage of self-employed is higher in developing countries. And third reason is government transfers are much less in developing economies. So this is actually also a policy implication because the impact has very different implication for different groups of people. And so policy should be different. This is especially true for elderly because they are the most heterogeneous group in terms of their wealth, living arrangement. Those who have assets, those who can borrow, those who have sufficient government transfers are less likely to suffer. On the other hand, those who have to rely on the labor, those who cannot rely on family, those who have a very limited pensions will suffer a lot after the pandemic. So that's actually a very powerful message. And then some policies actually worked for developed countries may not work for developing economies for that reason. And it's time to think about what is needed after, post-pandemic. This is very important because the pandemic has brought a very, economic recession. So, but it probably have some positive economic impact in the long run. So it accelerated the ongoing trends in working, increasing use of technology, automation, teleworking. So, which in turn will save actually a lot of, the biotech area, technological press, and pollution level has been declined. So government needs to prepare post-pandemic in this regard. What I'm saying is that the short-term policy is very different from long-term policy. So people just right now actually just focus on this year, 1 year, but we have to think about the long-term. And then also the last point is that obviously we need some evidence and data. We need more evidence and data. I cannot just emphasize enough on raising awareness of the coronavirus and its effect of the pandemic, but people just talk without data, first of all. And then many people are wrong about vaccines, for example. There are some political leaders who just underestimate the coronavirus. So this is actually a serious problem. So I kind of finalize my remarks by just emphasizing the raising awareness and the raising correct data. I think that's it. Okay.
Thank you, Dr. Lee. Another important aspect that we have been looking at is the psychological and the physical health. And that maybe we pose this question to Dr. Tao and Dr. Mansour. And perhaps what we would perhaps want to hear most from Dr. Tao will be this role of technology, which you mentioned that there's a big digital divide among older persons. But people do talk about then, but still, we have so much hope for the technology. How do you see this, so much hope for technology being actually implemented in your, care facilities or others? Dr. Tao, please.
Yes, I think that the one key thing is that I just want to say that firstly, I think the service has been targeted. As I mentioned, the older people are very heterogeneous, and some people are really important to get online. Right now, the Singapore government actually is encouraging every older person to get online. And I think that what we're trying to do is get them at least on two basic things. They can do WhatsApp and they can get Zoom. One about WhatsApp is they can help them stay connected, because groups of older people can stay connected, not just with the family, but also with each other. And they can actually, one of our centers how to do exercise with them, they do activity, they singing, so keep it connected and so have some activity and stimulation is very important. Just basic WhatsApp will do, okay? The other thing, the more, of course, if they have Zoom is better, they can do more learning activity and all. So I think staying connected and being used to using, not just later when there's another pandemic or another lockdown, to get them used to doing it now. Get older people used to using digital platform, used to doing activities together. And I would say that as much as people resist teaching older people, I think there's some ageism there. We found that they're not that difficult to teach. They want to learn. So I think fundamentally even that. The second thing is telehealth. Medically, a lot of people did break down because if they seem pretty okay, they will tell them not to come to clinic. Well, of course, we really don't know whether they can, how high the blood pressure or blood sugar is. So now more effort to telehealth and more home monitoring as much as possible. So a lot of us are just loaning up those sets for them. A higher level of technology would be more important, but I think at this point, we could just get older people to do WhatsApp and Zoom and family get on that, we would already be quite happy. So both in terms of in addressing the physical as well as mental health aspect, but keeping them connected and be able to do activities together.
Thank you, Dr. Zhao. Perhaps we then now turn Dr. Mansour on how do you see as the way to encourage and improve the physical and psychological health. I would also want to pose Dr. Mansour about the Malaysian Aging Retirement Survey, the MARS that you presented. And this really echoes what the Dr. Lee said about the importance of collecting data, understanding the well-being of older person from various perspectives. How do you see the role of MARS being informing the policy? Do you encourage other governments in developing Asia to consider doing the same, Dr. Mansour?
Thank you, Aiko. And definitely, Malaysia Aging Retirement Survey is a micro data, and it's longitudinal. Yeah, it's supposed to be collected every other year. And we are going with wave 2 now on the ground. And this time around, we include questions on the impact of the pandemic and more on the psychosocial, psychological, and also the mental health of individuals on the ground. Yeah, with this kind of data, I'm sure some other countries would have some kind of micro study, but it is very important, as Dr. Sao was saying, that they are not the same. Older people on the ground are different. One is different from the other. Now, for Malaysia especially, we are able to see that the social protection is very much something that we have to seriously look at, because the pandemic does expose us to issues or to gaps in our social protection system. And for older persons, with regards to their savings, yeah, the majority of them are still employed in the informal sector because the retirement age is 60 years old. So they are working in the informal sector, and it's the informal sector that will be shut down first during the lockdown. So they are greatly impacted by the economic, the economic impact is serious, and the government did offer the stimulus package or the cash transfer, although it is one-time payment, or it was split into 3 payments, right? But it is not a monthly income that they can plan their expenditure. So for Malaysia, I think the conversation is happening now, Aiko, that more forums and public discussions are around what do we learn from this pandemic? And I think for a country similar to Malaysia, this is something that that we can, we are all on the same boat, basically. Yeah, we do not have a comprehensive social assistance, especially for the older persons, that they rely on the savings or they work. Some of them will have to work for the rest of their lives. So definitely with the adverse economic impact or the income, the lack of income will pose a challenge, because the remittances from children are very important to the older persons as well. So when children lose their jobs, then older persons do not receive any income or reduced income from their children. So these are some of the problems that we are having here, but we are seriously, even among the government, are talking about moving forward the pandemic as it's been promised. This is not a once, you know, it's not a one-time thing. Of course, it's unprecedented in our generation, but it will happen again. So are we prepared for the next pandemic when it happens? Yeah. So maybe I'll just stop here first, Aiko. Thank you.
Thank you, Dr. Mansoor. With the limited time, let me now take a few questions from the Q&A. And there are 2 questions that is very much dedicated to Dr. Ogawa. So if you may be able to answer these 2 questions. One is about the dementia cafe. How are the dementia cafe actually called? I'm sure that there's a much less loaded term when presented to the subject. How is it called? And another question is from Anisha. I live in Japan for only 4 years, and it's amazing how Japanese government is taking care of elderly people. My question is, how much portion of the government budget to finance elderly people, and what are the impact on the policy and to the economy? Dr. Ogawa?
Well, I think the name is the Dementia Cafe. That's a real name. And we have altogether 7,000 cafes throughout the country. But as I said, you know, because of this social distancing is a major problem. So the, people cannot get together now. It's not functioning well. I think also the Japanese government has allocated some money, like particularly in the form of the long-term care insurance. You know, they provide the care to these people. All these people, once you join the long-term care insurance, medical doctor check the physical condition and then classify it from level 1 to 5. And then depending on that, government provides the financial assistance to these elderly persons. But I think the point that I talk about the value shift, let me just emphasize one more point. The reason why I emphasize this value shift in the past 50, 60 years in Japan was that back in 1970s, Japanese government said, you know, Japanese family system is so strong. Maybe that's Japan, co-residency, Japan's latent asset. And then based on that, they trying to introduce the long-term the in-home care rather than hospital-based care. And then people responded negatively, which government never realized. I mean, it wasn't aware of that. So in other words, this is a message to the Asian developing countries. When you change the policy, make sure you make sure that there are 2 kinds of value shift. One is continuous as a function of development. The other one could be abrupt shift in the values. So depending on this, how the people respond, the policy doesn't really work well. And my last point is that, you know, here, I would like to propose that, you know, age, I talk about 65 as a cutoff age, but this 65 years old has been used since 1916, more than 100 years. And at that time, life expectancy was only 42 years. So I'm saying that if you include, if you just apply the cognitive the data, like based on the various surveys, Japan is worse in terms of demographic data. But if you adjust the dependency ratio by using cognitive score, Japan is not really bad. It's in fact right in the middle of the European countries. Japan is not the most aged society once you adjust the dependency ratio by the cognitive capacity. So I would like to see that maybe in Asia, maybe you should start looking for the re-measuring the population aging. Then you can have another the wide open area for research and the policy agenda. Thank you.
Thank you, Dr. Ogawa. Now we have another question. It was actually the first question on the Q&A box. What would be the best way of carers to help mitigate the emotional and mental negative effects, deterioration of the pandemic or quarantine to our elderly family members? Perhaps this we would like to ask Dr. Tsao to answer.
Yes, I think probably the caregiver, like I said before, some of the older people, the caregivers are not well prepared because mostly they have left the care to day centers and other service providers. When that's cut off, they were really stressed on how to do that. So they need to be better training now and more support later on when another lockdown occurs. Second things, I think we have to target better. I think we came up with some risk stratification to identify who needs care, and then some got more, some got less, and we was too strict. One of the key things actually for the more vulnerable, where the caregivers are maybe elderly or there are not enough of them, that we have to be more, a little bit more lenient about getting services to them as well. So to reassess how we assign care and how strict or not strict we want to allowing regular services. But more training and more support for them now, getting them prepared, as well more support when time comes is important.
Yes, indeed. Thank you, Dr. Tsao. There was one question regarding how does then ADB would be able to support support older person in pandemic and building the pandemic, after pandemic better. Perhaps this question I would like to pose to our chief economist.
Thank you, Aiko, and thank you, ED Rose, for asking this very important fundamental question: what ADB can do. All the panelists mentioned supporting elderly's livelihood and well-being is cross-cutting physical, mental, social dimensions involved. So I think ADB can do a lot of things. Here, quickly, four aspects I'd like to highlight. Number one is to achieve a broader perspective, to achieve a no one left behind principle of Sustainable Development Goals, SDGs. Universal health coverage, UHC, has been the key. And in fact, Strategy 2030 of ADB, putting 7 key priorities, and priority number 1 is addressing remaining poverty and reducing inequality, including providing better health for all. So I think UHC is a really important area ADB can support, not only through providing financial support, proper financial support together with, but also policy advice and also supplying relevant knowledge products. Number 2 is infrastructure. And actually, after the outbreak of pandemic, creating a quick response mechanism has been one critical area ADB has been supporting. But in the medium term, COVID recovery and beyond, I think ADB can support in strengthening health systems, including infrastructure, and also building capacity, and as well as to address the impact on jobs. Vaccine production delivery is also area we can support in medium and long term. And seeing this social determination of physical and mental health, I think providing a proper multi-sectoral infrastructure to the elderly and elders are really critical. Number 3 is actually earlier this year, September, we released Asian Development Outlook theme chapter, update theme chapter titled Wellness in Warring Times. And in this same chapter, we highlighted wellness economy is the engine of Asian growth. Before COVID-19, 11% of regional GDP is wellness sector. And also wellness sector is growing 10% annually. And supporting this wellness industry is not only supporting elderly and vulnerable, but also supporting overall economy. And a government can do lots of things, creating a health-built environment. For example, prioritizing walkability in urban planning, and ADB can support this infrastructure, broader infrastructure program, and also support the physical activity by funding public infrastructure, including sports facility and different facility to support not only physical but also mental health. And finally, but not least, I think providing knowledge for evidence-based policy making to support the elderly during and also post-COVID-19 is very important. So today is a part of our initiative to tackle knowledge and evidence-based policy. So I think this technical assistance we just launched, I think this can be really one of the core activities of ADB in supporting this area. Okay, thank you. With that, I'd like to stop. Yeah, thank you, Aiko.
Thank you, Yasu. So now the webinar would come to the end, and I know we had more questions and other issues to discuss. We hope to continue this dialogue with a new regional research project on population aging, which will be launched, and it would have a number of dialogue events, hopefully more webinars to invite you to discuss this issue. And following that, I would also want to advertise our next Asian Impact webinar on online platform to catalyze inclusive growth. And this will be next year, January 13, starting from 3:30 p.m. Please register to join this conversation. Thank you very much again, all the panelists and the participants to the webinar.